This is a case study story of how one clinician and one information specialist worked together on a practice-based research project. This case study is a composite fictionalized account of how our information specialists partner with clinicians. We do not actually have an information specialist named Lori, nor do I know a clinician at St. Mike's named Tara, and any resemblance to real persons, living or dead, is purely coincidental. This is Tara. Tara works here at St. Mike's and she had a clinical concern. Tara noticed that many of her patients had serious problems sleeping, and she was worried that it was affecting their recovery time and length of stay in the hospital. She wondered if there was anything she and her colleagues could do that might help, any changes that they should make to their practice. They had discussed some ideas, but they really weren't sure what to do. Tara took the time to Google her question, and she found lots of interesting items. Over 100,000. Some of the articles were really interesting, and they gave her even more ideas, but she worried about a couple of things. One, were the suggestions being made in these articles evidence-based? Two, there were some articles referred to that she couldn't find, and when she clicked on them, they kept asking her to pay money. And three, how would she test or implement any of these ideas in her own environment? One day she noticed in the Daily Dose that the library has a class in searching Google, so she attended the class. While in class, she is reminded about the hierarchy of evidence and that decisions should be based on good evidence, and that it is very hard to weed through Google findings for good peer-reviewed literature. She is introduced to critical appraisal theory and tools. She also learns in the class about the many other classes and services that the library provides. In the days and weeks to come, she also takes a general searching class to learn more about the concepts of searching databases. She begins to realize that accessing quality health information is a lot more complex than finding a good restaurant for dinner. Tara drops by the library and asks the desk staff for help. The desk staff show her how to find the library's website and where to find the Sally tool, Search All Library Information. They search Sally and they find lots of articles, but they all seem kind of specific and not quite what Tara is looking for. She doesn't have much more time that day, but the staff person suggests she make an appointment with her information specialist for when she does have more time. He explains that each program or department in the hospital has a specific information specialist assigned to them, and that hers is Lori. He gives her Lori's business card. Before she goes, he also shows Tara the resource guide for nursing that might be helpful. The next time she has a chance, Tara takes a look at the resource guide, and she views a video about evidence-based practice, and she is introduced to the JBI database. She finds an evidence review sheet on her topic. She wants to read some of the articles that are referenced in the review sheet, but she's not sure how to get them. She also thinks it might be helpful to see if there are any further articles that are even more current and applicable to her environment. She calls Lori, her information specialist, and makes an appointment. Lori listens to what Tara wants to do and helps her refine her question. Is there anything that can be done by frontline staff to improve the quality of sleep for her particular patients? Some of the questions that the information specialist could ask would be, what unit do you work in? What kinds of patients do you have? Are they all adults? Are they surgical? Critical care? Do you know what is disrupting their sleep? Is it pain? Noise? Are you not sure? Once they have refined Tara's search question, Lori recommends that they conduct a literature search. Together they search JBI and CINAHL. CINAHL is probably the best database for literature in nursing and health disciplines practice. They find quite a few useful articles. Many of the articles are available online from the library, but some have to be ordered from other libraries. Lori shows her where on the website to find the appropriate forms for making these requests. Tara reviews the literature, keeping in mind some of the tips she learned in class and from Laurie about critical evaluation of literature. She realizes that not all published studies are the same and that some are better than others and lead to more trustworthy evidence. After discussing with her colleagues and her supervisor, the unit decides to undertake a simple study. Their goal is to implement one of the ideas they have read about in their own setting and determine if it will result in an improvement for their patients. Tara invites Laurie to sit down with the rest of the team as they plan their study. Laurie provides support for the team by letting them know of useful resources in the library such as research methods books, access to SPSS, a computer program for doing statistical analysis on research data, as well as articles, books, and websites on grant applications and how to prepare them. She showed them how to access electronic books and articles and how to download them onto their own iPads so they could read them at home. When they had additional questions that they needed help with, Laurie would look for information on that topic and deliver it to the team. To help them keep track of all the literature they had compiled, she recommended they attend an EndNote workshop the library was giving. Later on, after the team had successfully conducted their research project, they decided to write an article on their project. Laurie helped them by providing access to resources on how to write up research. She ensured their bibliography was complete. She provided information on possible publications to publish in, and she helped to ensure that the article submitted was formatted according to the requirements of that publication. When the team decided to do a poster on their project for the program's Research and Education Day, Laurie suggested they attend the PowerPoint workshop the library was giving, especially designed for using PowerPoint for developing research posters. When Tara and one of her colleagues were asked to deliver a presentation at a professional conference on their project, they called Laurie for help on creating a more dynamic PowerPoint presentation. Laurie referred them to another information specialist on the team who excelled with PowerPoint, who then spent an hour with them helping them to develop animations and other graphical representation of their data to improve their presentations. A few months after the project ended, Laurie ran into Tara in the library. "Hey, nice to see you here." "I come here all the time now," said Tara. "It's a great place to come for quiet and reflection. If you haven't been to our actual library, I can guarantee you that it's nicer than in this picture." I hope this story has given you an idea of how we can support your work. We are here to try to make your life easier. Drop by or give us a call at extension 5059.